Coming up next is a keynote address by Mr. Abhishek Singh, CEO, MyGov, President and CEO, NeGD, and MD and CEO, Digital India Corporation, MeitY, Government of India, on the topic driving inclusion, innovation, and scale in public digital infrastructure. Welcome, Mr. Singh. Please take it forward.
Good morning, everybody, and thank you for inviting me to the National Governance Summit being organized by Economic Times. It's an honor and privilege to be speaking here and listening to the distinguished panelists throughout the day. As we know, like when we talk about the story of India's digital transformation, we look at in what ways we have been implementing large-scale digital transformation projects, which has helped transform the way we deliver public services. When we look at the India's scale and magnitude, that ensures that we have to have a system in which whatever services are delivered is designed for a billion people and is able to address the needs and requirements of a billion people. So whether the public digital platforms or the unique ID project, the Aadhaar project, or the UPI project that's been implemented, or the DigiLocker, in all these projects, what matters the most is how we can design something which is robust, which is scalable, and which meets the requirements of the entire country. And we have got fairly high degree of experience in implementing such projects. And this has become the foundation stone. This has become the basic building block of all digital transformation projects that we are implementing. And this has been like the key feature of all our digital projects. Innovation has been the driving nature about all our major initiatives that we have taken. And while we do take up innovative projects, we always look into two key aspects. One is the kind of technology that is being used, and the second part is how do we make these projects more inclusive. So when the first phase of Digital India projects was implemented, always the question was there, are we going to ensure that these online services are being made available for each citizen in the country, or only for those citizens who have access to a device or access to connectivity or access to skill sets to access these services. So while doing so, the concept of common service centers came in, because it was well known that in India there's a large section of people who will not be able to access e-services if they are not provided the necessary assistance. And with this objective, the network of 400,000 common service centers were set up, wherein citizens can go and access services in an assisted mode. So this ensures the inclusive part of ensuring services when we are taking up digital transformation projects. The other aspect about inclusion comes in from making services available in various languages. So right from the beginning, all projects that are being implemented are to the extent possible made available in various languages. And also now we are moving on from not only making available in various languages, but enabling voice access to services, which brings in the possibility of making services available to people who do not understand, who are not able to, who are not literate also. Can they access services through voice mode? So we already have around 700 million people in India who can access services through smartphones and through connected devices. But there are another 500 million people who are yet to be onboarded onto the internet. And we strongly feel that once we take up projects in various languages, when we bring in voice enablement of services, that will ensure that these 500 million people also are also able to access services. Toward this objective, we're implementing a project called the National Language Translation Mission. Under that, various tool sets where for delivering services in various languages is being developed. So that not only brings in the inclusion aspect, but also brings in the innovation aspect. The other key aspect about innovation that we talk about is always like how do we make things simple for citizens? How do we like use technology in such a way that people are able to access services in a very easy to access format? So one example that I would like to give is that we implemented as part of MyGov, wherein we developed a chatbot on WhatsApp that allowed people to access services and information during the COVID-19 pandemic. How it worked was that like lot of information regarding the pandemic with regard to what to do or do's and don'ts, etc., were being made available on our portal, on our app. But many people were not able to access that because they would not know how the URL of the portal or which app to download. So for them, what was done was that the same information was provided on a WhatsApp interface, wherein they could go to our WhatsApp line, the 9013151515, the MyGov help desk number, and they could just write a hi there and access services. So the innovative aspect of the MyGov help desk was that like you just enter the hi and then you can ask any question with regard to the COVID-19 pandemic, and it was able to access information about that. So people could ask where can they access a doctor, what are the symptoms, where can they get help from a health service provider, and what to do, what not to do, verify fake news, get information, get videos from renowned doctors. And over a period of time, this informational service on WhatsApp chatbot was transformed into giving information with regard to vaccination. So this vaccination module was also built up, and it was AI enabled. So if you want to get for vaccination, you just go and say that book appointment, and the system will keep on asking you to get you an OTP, and it will allow you to book a vaccination slot on you of your choice near your residence, and they allow you to download the appointment slip. And after getting vaccinated, it would also allow you to download a vaccination certificate. And this whole MyGov help desk that was launched helped us reach out to more than 80 million people in just around a year. And after that, now we are seeing a lot of many people, almost 3 crore people have downloaded vaccination certificates through this service, and more people are accessing it every day. In fact, the number of users that are adding onto our service is almost 50,000 per day. And now we have expanded the chatbot to provide services with regard to other public services like the downloading your driving licenses, downloading your PAN card, downloading your academic certificates. So all documents which are available on the DigiLocker have been made accessible through the AI chatbot interface on WhatsApp, which allows people to just simply follow the conversational AI route and access all the documents in the on the DigiLocker and get access to them. So it's a very innovative way of use of technology for providing access to public services, and at the same time, it takes into account the consent part of it, wherein the consent of the citizen for providing the services is also taken. So this is one of the initiatives which I wanted to mention. Another interesting initiative that was implemented, of course, during the pandemic was the Arogya Setu project, which used the Bluetooth contact tracing for not only alerting people if they had come in contact with somebody who was COVID-19 positive, but it also helped us in identifying hotspots and ensuring that the health authorities could take necessary steps for isolating that area and for containing that area to limit the spread of the virus. And as we went on, now the Arogya Setu is being developed into a universal health app, which will become part of the Ayushman Bharat Digital Health Mission, which will allow you access all the services that the National Health Authority is going to provide through the Ayushman Bharat Digital Health Mission. The another initiative that was taken again for India's vaccination effort was the CoWIN platform, which allowed people to access vaccination information, book appointments, and do that. This is again another challenge that required a solution which can be scaled up for a billion plus people, because vaccinating, so far we have not conducted any vaccination program which required vaccinating everyone. So this is the largest vaccination drive that we implemented. It was slightly more complex because everybody was to be vaccinated and everybody was to be given two vaccines, two doses of the vaccine, and there were multiple vaccines possible available, and the time gap between each vaccine was also different. So there could only be a digital way of keeping track of who has taken what vaccine and when does he take the second vaccine, and also providing a proof of um, vaccination certificate in the form of downloadable vaccination certificates. And then when also this was done, and with the economy was to be opened up, there was to be requirement of a means for verifying these vaccination certificates. How did you do that? So for that, open APIs were provided and then was integrated with various service providers. So you could access your vaccination certificate on the CoWIN portal, you could access it on the Umang platform, you could access it on the DigiLocker, you could access it on Arogya Setu, and it was also integrated with private service providers like MyGate or like Zomato or like Amazon, which allowed you to verify the vaccination status of a person who is interacting with you. So this is again innovative use of technology, building scalable systems, and providing API level access for verification of services. So this has been the hallmark of entire initiatives that the government has taken for implementing digital projects. And now, as we go ahead, and we are trying to build up artificial intelligence based solutions and products which can be developed, which can developed and deployed. We have seen numerous examples in which in which MeitY, along with state governments, have been implementing such solutions and programs. In Tamil Nadu, we have worked with Tamil Nadu government to develop the e-Parvai solution, wherein what it does is that it takes images of cataract patients and compares it with the data sets that are available and is able to predict up to 98% accuracy whether a person requires cataract surgery or not. Similar projects have been implemented for diabetic retinopathy. Similar projects have been implemented for breast cancer diagnosis. In agriculture, Telangana government has implemented some projects wherein crops which are infected by pests can be identified, can be and it saves the requirement of a person to go to a health service provider or to an agriculture scientist and gets the diagnosis done by sending the image of a infected eye or image of a scan or the image of a crop which is having some damage. So but the real problem is not that these pilot projects have been implemented. While these pilots are very impressive and they have given good results, the real challenge with the government is that how do we scale it up? And for doing that, what we need to do is to have a proper data governance framework which allows data sets that the government has with regard to all these tests that are done in laboratories and in agriculture universities and in hospitals, and making it available for researchers after anonymizing them, after removing the personal attributes from them, and ensuring that researchers are able to work on those data sets and build solutions which can make these algorithms and make these tools better. So for that, MeitY has come up with the draft AI draft data accessibility and use policy, which prescribes setting up of a India Data Council and India Data Office, which will ensure that all public data sets that are available are anonymized, are made available for researchers and for entrepreneurs who can use it for building and designing their projects. This draft policy is up for public consultations and till next few days, and it's going to really help create the data economy that we have been talking of. There have been reports that ensuring access to this kind of data, ensuring making this data publicly available, can add almost $500 billion to our Indian economy. And if we have to really go up on the AI value chain, we have to ensure that these data sets are made available. We have to ensure that these data sets help in building products and solutions in the health space, in the education space, in the agriculture space, in NLP space. And these products and solutions which are developed in India, deployed in India, tested in India, scaled up in India, will then be made available for deploying across the world. And any solution for solving societal challenges, if it has worked in India, then it can work anywhere globally. So that is the AI strategy that we have been implementing, and that's detailed in the national strategy on AI with our AI for all, a responsible AI framework, which will help us move up on the artificial intelligence ladder. The other emerging technologies that we are working on and implementing are incorporating blockchain-based networks for ensuring that any data that is available at any node in the India's public blockchain can be verified independently, and it will ensure that the time taken to verify the credentials of any data set is much lesser. For this, on the DigiLocker project, we have been working with CBSE and academic universities for ensuring that academic credentials are put on the blockchain and are made verifiable. We have also enabled API-based verification of documents on the DigiLocker, which has reduced the time taken for conducting, say, recruitments. We had an example from Karnataka Police, wherein they were doing constable recruitments and they had to verify data of class 10th and 12th mark sheets of the applicants. And earlier, this system used to take almost 6 months to verify that. But with the DigiLocker interface, they could save a lot of time, and the recruitments were done seamlessly. Similarly, for academic universities, admissions and all these verification of academic credentials done through APIs and from a trusted network saves a lot of time and ensures that the decision making process is much shortened and the hardships of citizens is being reduced. Over and above this, once we are having these kind of digital systems being implemented in various departments, we are also trying to move up to a kind of a single sign-on system wherein citizens will be able to log in and access multiple services with a single sign-on instead of trying to remember multiple usernames, credentials, and passwords. And it also helps in integrating various services, because now when all services are being implemented in a digital format, there is a possibility for moving up in delivering services to citizens based on their entitlement rather than they applying for services. And what it does is that it integrates various services at the back end. For example, if somebody is a beneficiary of Mahatma Gandhi National Rural Employment Guarantee Program, and the Rural Development Ministry has identified that person to be poor enough to be eligible for Manrega wages, then that same beneficiary should, that information with regard to that beneficiary should also be available to the health system, and they should be able to assess whether he should also be a beneficiary under the Ayushman Bharat scheme or not. Similarly, he should also be entitled for a ration card, which is implemented, which is given by a different department. And if we know about the attributes of a person, then and if he is deserving of a scholarship under any scheme for minorities or for weaker section of society, then that scholarship or that pension or that benefit to that citizen should be given to him on the basis of his entitlement without he having to apply for those services also. So that's the paradigm shift today that's being possible with these kind of integrated systems, wherein instead of citizen applying for services, government can go ahead and deliver services based on the eligibility and based on the entitlement of the citizens. So we are implementing a project in this direction, and with in partnership with state governments, and very soon this may become a reality. Over and above that, there are mechanisms being built up which will allow citizens to do end-to-end tracking of their services. For applying services, do not need to ask only once. Like if any government department has established any particular fact about a citizen, any other department should not be asking that again. So if the government system knows that somebody belongs to a particular caste or has a particular income at a particular time or has a particular date of birth or particular address, if this information is available in a government system, that information should be shared across other systems to ensure that the hardship that a citizen faces in trying to prove his credentials to every public authority is reduced, and the time taken for delivering services becomes shorter, and the overall experience of citizens that they have in accessing services becomes better. So there are a lot of innovative approaches that are being tried in all these directions, and that's not only ensuring efficiency in delivery of services and ensuring more services accessible to citizens, it is also ensuring inclusion in the true sense, in the sense that every citizen for whom a service is being designed is able to access these services and is able to benefit from these services. And that's the true intent of Digital India. That's the true intent of the tagline of Digital India, which is power to empower. In what ways we can use technology for empowering people, for improving efficiency of the government, plus improving the satisfaction level that citizens have in accessing services. So this is what I wanted to mention this morning. And if there are any questions, I'll be happy to take.
Thank you so much, Mr. Singh, for bringing great and informative content to the table. Indeed, a lot to learn from these sessions. Now, ladies and gentlemen, we'll switch to the next session. Stay tuned and yes, keep tweeting using the hashtag ETNGVS.